Hello, I'm Dr. Doug Teller. I'm an addiction medicine specialist out of Kettering Hospital. And in this segment, we're going to talk about prescription opioid or pain medications and sedative hypnotics, benzodiazepines, and drugs of this type. And how these different drugs work within a person's body. To start out, I'd like to look at the opioids specifically. How do opioids work? What are they prescribed for, and are they effective? And this class of drug obviously is for moderating pain that people experience. These medications can be roughly classified in about 4 different subsets. You have agonist type medication. Those would be drugs like morphine, codeine, drugs like hydrocodone that's in Vicodin, or hydromorphone and Dilaudid. Another one that's very commonly prescribed nowadays is oxycodone, and drugs like Percodan, Percocet, and OxyContin. These medicines obviously have a tremendous amount of effect on pain, especially in an acute setting and in chronic malignant pain circumstances. They are effective, but they come with the caveat that they should be monitored as they're used. Other medications that might be included in the opioids are partial agonists like buprenorphine. Suboxone is a medication that many people are hearing about nowadays. The mixed agonist-antagonist type drugs, pentazocine is the prototype. It's also known as Talwin. Then you have the antagonist drugs like naloxone, Narcan, and naltrexone, which is Revia or Vivitrol. And these are medications that have an effect to oppose the action of opioids in the central nervous system. So if you were to use either of those medications I just mentioned, naloxone or naltrexone, then you would not be able to experience the effect of opioids. How about benzodiazepines? How do they work? What are they prescribed for? Are they effective? Well, the benzodiazepines are anti-anxiety type of medication, either acute or chronic, low-level anxiety. And what they do is they kind of work to dull down the way cells in the central nervous system receive stimuli, therefore they don't become as reactive. And in some circumstances you want to be careful with stress and how it may cause a person to engage in aberrant behavior, but at the same time you want to still be alert and be able to respond to environmental stimuli. What are some harmful side effects of prescription opioids and benzodiazepines? And I would say here for the opioids and benzodiazepines specifically, dependency and abuse is certainly there. Even in the person that's faithfully taken their sleeping pill every night for 15, 20 years, to go without it may cause changes that they don't expect to. And also, as a person uses these medicines over time, they may find that actually the effect of the medication becomes more than they expected previously. There's also a synergism, more than additive effect of taking the two together, where you have a 1 + 1 = 3 situations that could put us in a compromise our abilities, such as hazardous conditions like driving potentially, or other circumstances like that. Another thing that really is important for virtually all population groups, but especially the elderly, is the effect of opioids on the intestinal tract and the potential effect of constipation, because constipation is something that can actually lead to altered thinking and reacting to our responsibilities that we have on a day-to-day basis. Another question, if drugs like Vicodin, Percocet, Tylox, and Xanax, Xanax being a benzodiazepine, the other 3 being opioids, cause so many problems, why aren't they illegal? Well, when you think about it, in a sense they are illegal, secondary to the fact that they require prescription to obtain. And because of this prescription, it just comes with the extra caution that there's an expectation of monitoring by the prescriber, and hopefully the prescriber will invite other concerned significant others as they relate to the patient into kind of a careful watchfulness of the patient's behavior. How do you tell if someone is experiencing an overdose? Besides calling 911, what else should you do? Well, I think that it should be emphasized that calling 911 is the most important thing to get a professional help on the way as soon as possible. We're very fortunate in our community to have paramedics that are very responsive and extremely professional. We need to make use of them, particularly in this situation. If a person is non-responsive, that's a good sign, not able to interact with you in a logical, clear way. Slurred speech, decreased respiratory rate can occur. One thing that you might be mindful of when you see a person down is there's kind of two things that are working at odds. One is that a person that is under the influence of a drug, intentionally or unintentionally, may actually aspirate or inhale secretions from their mouth, and so turning a person on the side may be helpful. At the same time, if there is a fall experience and there's a neck injury, it's probably better not to try to move the person from side to side, but to await the professionals that come with the 911 call. The bottom line is call 911 and they will respond as soon as possible. I should also make mention to you that there are two antidotes that are out there specifically for opioids and benzodiazepines. For benzodiazepines, as mentioned earlier, the opioids as mentioned earlier was naloxone or Narcan, which can reverse the effects of medications like Vicodin, Percocet, and the like very quickly. And there's also medication called flumazenil or romazicon, which is an antidote for the benzodiazepines. This last drug, the flumazenil, is important to be careful using, because if a person is using benzodiazepines chronically and then they're given flumazenil, it could induce seizures. So it's probably best not to use this medication unless a person is not tolerant, has not been using benzodiazepines chronically.